Hello. Good morning, everybody. Welcome you all to the 9th edition of Health Tech. So we will be, commencing with our opening session. We have with us Mr. Abhijit Banerjee, President Designate, the Bengal Chamber, and Head of On-site ASEAN and South Asia, Linde India Limited. Dr. Alok Roy, former President, the Bengal Chamber, Mr. Abhijit Majumdar, Chairperson, National Health Committee, the Bengal Chamber, and Chief Executive Officer, Apollo Multispeciality Hospitals Limited, Mr. Shantan Chatterjee, Co-Chairperson, Health Committee, the Bengal Chamber, and Partner, PwC, and Dr. Andrew Fleming, British Deputy High Commissioner to the in Kolkata. So I would request the dignitaries to please join us on the dais. Ladies and gentlemen, this program is being presented to you by the Bengal Chamber of Commerce and Industry with Apollo Multispeciality Hospitals, along with knowledge partner PwC. We are delighted that Dr. Roy has joined us today because we started this initiative under his guidance and mentorship, and PwC has also been our knowledge partner throughout all the editions. So with this, I will take a minute to take have a photo opportunity of the dignitaries on the dais. Thank you. So with this, I would request Mr. Abhijit Banerjee, the President Designate of the Chamber, to please do the formal welcome address.
Dr. Andrew Fleming, Dr. Roy, Shantan, Abhijit, ladies and gentlemen, it's a great honor for me to welcome all the distinguished guests here for the 9th edition of the Health Tech Summit organized by the BCC&I. Over the last 8 editions, the Health Tech Summit has addressed various important trends which the healthcare industry is going through. Digital transformation in the new world, health for inclusive growth, making healthcare smarter with AI, quality care towards good health and well-being, and so on. Over the years, this platform has put forward opportunities of discussion which are meant for benefiting the professionals and service providers in this industry with the ultimate aim of providing better care to the patients. Today's mandate is both a challenge as well as a great promise. It's about responsible healthcare, making efficient with good governance. The healthcare segment in India is not just going through an evolution, it's going through a dramatic change, more like a technological renaissance. And the new era reimagines the patient not just as a recipient of care, but as a central heartbeat of a system that prioritizes well-being of all the citizens. Responsible healthcare is a holistic vision. It encompasses effectiveness, quality, equity, safety, extending far beyond the walls of a treatment room to provide ethical, affordable service for every citizen that also comes with accountability. Talking about accountability, I think it's pertinent to note that as we delve deeper into a digital world, the pillars of privacy and security have now become non-negotiable. Everyone is aware in India we have the DPDP Act of 2023. There are other initiatives also which are setting forward the architecture for this transformation. What is this for? It's a commitment to transparency, accountability, and good governance, and all these go a long way in fueling investor confidence. We've seen quite a big of surge in private equity in this segment, and it's not just passive capital, it's a strategic catalyst for the growth of this segment. It creates a virtuous cycle where digital intelligence and capital efficiency work together to create a positive ripple effect across the entire economy. To that end, our knowledge partner PwC will be releasing a thought paper today, Navigating Privacy and Protection in India's Healthcare Digital Frontier. This will, of course, be followed by brainstorming panel discussions on all these topics. Let us use this ninth edition to ensure that our technological prowess is always matched with our ethical responsibility. Together, we need to ensure that healthcare is not just made more efficient, but more humane. Thanks. Thanks a lot.
Thank you, sir. We would now request Dr. Alok Roy to please deliver the theme address.
Thanks. It's always a pleasure to be here in any Bengal Chamber function, not only as a past president, also as a somebody who is kind of keeping a track of where business is heading in this part of the world. This chamber has been around close to 200 years, and 200 years is a long time. And its legacy, the way it has contributed to the growth of business, has been huge, huge. The very fact that those who are sitting here most of them are leaders in their respective fields, says what I was saying just now. So we started this health tech. Can I have the first slide, please? We started health tech. She will change it. She will change it. Okay, I'll change. Okay, I can see it here also. All right. So the very fact the topic is responsible healthcare and is the topic. We are talking about technology, and why are we talking about responsible healthcare? Next slide. Go back. Before, second slide. This is the second slide? Okay. The topic is responsible healthcare, creating efficient systems powered by strong governance. Today morning, when I was preparing the slide, my thought process, just aligning it. Then I said, let me make some slides. So I made few slides. Then I called my son, who's engineer and who's an MBA from INSEAD. And then I said, fill it up. Then he started laughing halfway through. He said, what are you writing? I haven't seen those machines. I said, once you have lived for 50 years in healthcare, then you have seen a lot. So creating efficient system powered by strong governance. So what about technology? Today, when you are going to the bank, I remember when I started my first hospital here, some 40 years back, BM Birla Hospital. My best friend was my bank manager because I used to go and meet him every day or every alternate day. I had to go and sit in his office and talk to him and then change some funds. And when I applied to a bank for applying loan, that time I asked for 2.5 crores, that I got some 21% interest. And it was very generous of him. It was 24, he brought it down 21. And I had to stand there in a queue and give so many papers, and giving money was unheard of. Today, you can sit in your office and transfer 5 crores online from a mobile phone. You don't have to even go and switch on your desk. You may have to do in a few tranches depending on your limits. Are we doing the same thing in health? Where have we lacked? Why the financial IT, information technology, has grown so much in any other sector but not in health? So let's walk through this. So which started as a peripheral, technology started as a peripheral, became supportive, became integral, became all pervasive, godlike. Now they want to replace doctors. Is a replacement tool or augmentation tool. And then what is the end point? Let's look at it a little more systematically. Next slide, please. Peripheral. I don't know whether many of you have seen these devices. There used to be dictaphone. we used to write there, and my secretary could never, she used to replay backward, forward. Typewriter was that you push one side, one wrong mistake, you have to put white fluid, push it back, again type. We saw this developing. Then a word processor came. Word processor screen was 1 finger long, that's all, this much. And Word used to run in that. You can see it, correct it, and type it. Then came the dictaphone, then the calculators were the very important. Next slide. Then came supportive. The computer was one floppy in of a program, one floppy with the data. And then it will analyze, show something on the screen. So when I asked my son today, have you seen that floppy driven computer? He said, I'm not that old. I said, no, you're just before you were born, I saw it. That's how technology was changing, very slowly, very slowly. And the printers were black and white. When the printers arrived, we were so happy. We used to hear that Rajiv Gandhi used to be our Prime Minister. And when he was flying, he had a word processor and he printed it in his flight, whatever he wanted to do. That was kind of a great information for us. When the Bluetooth came, technology, we were so excited by just hearing about Bluetooth. So that's how technology started coming in step by step. And then attendance, HMIS, they were all supportive. They did not make a great shake in healthcare treatment. Nothing changed. Next slide. We went to now it's a very integral part. The digitization happened. The medical records are all, we got a message from C that please get your medical records online, and all the doctors have to give their prescription, digital prescription, and patients have to know about their rates. It's all digital. HMIS is being used for data analysis, competence mapping, Internet of Things. Most of the things are Internet. LMI system, lab management system, where all the reports are generated online. Patients have information coming. Today, a lot of hospitals here in this room are sending information to the patient that your appointment is booked on so and so date. Please come in. So that's how the technology is moving forward. Now, it has become all pervasive. There was a time we didn't have a receptionist in the hospital. I've seen it. There was a time when there was no accountant. There was one billing department, some corner. We never had a accounts officer. There was a time when the discharge summaries were not given typed. It was just handwritten, few lines, just few lines. See me on so and so date. From there, we have come to very all-pervasive digital technology. And that technology, which is all pervasive, what is it doing? How is it helping? Are we responsibly dealing with it? What are we doing with it? Let's see that where we have reached with technology. Next slide. Technology is using in diagnostics. So it's trying to replace us or augment us. I will not use word replacement that strongly as of now, but who knows? See, my son works in New Jersey, and he is the head of 4 hospitals of their critical care department. So if any patient comes with brain stroke or something, the AI filters it, and if there's a ischemic or it's hemorrhagic, it goes to every person in critical care on their mobile, WhatsApp, and to every neurophysician or neurosurgeon who is available there, and to the radiologist. It is all done by AI. If a patient comes, and all are linked, connected, if the bed is connected, the patient parameters are connected, all his data are connected and constantly being filtered. What a great step in right direction. Very right direction. AI in monitoring, I said, AI in analysis. We can analyze all our data whenever we want it. What kind of people are coming, what is the profile of patients coming in, what are the people who are using us, what age group, what do they require, where we should invest more, where we should not invest. Picking up a facility is not just because of my fancy, I wanted to buy a hospital. No. What population it serves and what kind of people are there. So when I am building a new hospital in Tartala, so I realized that our population of people who are above 60 is good 30-35% in Calcutta. So if I have to build a hospital, children don't need a hospital. There are very few children. The children falling sick is far, far less than old people falling sick. And children, if you give a small care here and there, they recover. Whereas the old people need a very, very focused care. So you need to think, what are we providing, and using technology, using analysis. And now AI is in surgery, robotics. It tells you how much you'll require, where patients are. So all those things. When the patient falls or something happens, the technology exists which tells you patient has fallen. You wear it in your hand, it tells you fallen, and it sends the messages to everybody. So that's how the technology is, all from being all pervasive, is also trying to help us in a big way. Next slide. Now, whose interest do we have at our heart? What Mr. President Designate said just now. Whose interest we have in our heart? What are we doing? We don't say don't pay money. Is it investors? Is it promoters, doctors, or patients? Where are we here? Why are we here for? We are here for patients. The only reason why we exist, because people need us. Next slide. So, if let's say how technology helps us in good governance. It's for investor with good governance, investor interest and promoter interest is normally tied to EBITDA, return on capital expenditure, expansions, P, growth, risk mitigation, and predictable decision making. That's where the technology is helping us mostly. When investment is made by a corporate sector, it's not that I don't want to run it down. I'm not criticizing them. I'm just presenting facts. That when investment is made, the returns are calculated. Of course, if you don't provide a good services, nobody will come to you. But how far you're thinking of patients, that's something we should not lose sight of. The purpose of seminars like this, when we started in 2008, was not to compete with each other in telling how good we are technologically wise. Or the purpose was not how to bring technology to the people in Calcutta or Eastern India. No. Purpose as a chamber was to philosophically, can we take a step back and see where we are heading with technology? And can we bring values into the usage of technology? See, there is no point. You all can be very rich. You all can have big houses. But at the end of the day, you will not be seen for your big houses. You will be seen by what values you have lived with in life. And that values which you live with will decide what legacy you have left behind. So when we have got a deputy commissioner here of Bangladesh, the first thing I asked, I'm so happy to see that new government has come, which is more friendly for each neighbors. It only helps. If you have a friendly neighbor, you have unfriendly neighbor. So what values we live with? So technology must build value inside. As President Designate said, last sentence, I loved him for that. That what human values they are bringing. Is technology bringing human value? That's important. Next slide. Making efficient with good governance is what is the patient interest and what is the doctor's interest. How do we bring those together? How does patient use technology when somebody gives his blood? Are we able to send him reports within 2 hours? Is it sent to him? When he doesn't pay money, we remind him 100 times or more. But when his blood doesn't reach here, do we tell him that sorry, the reports are getting delayed. How quickly we discharge him. What kind of medicines we use. How ethical we are in using antibiotics. Are we using antibiotics where I am getting cuts? Or I am using antibiotics? Is my microbiologist on board who tells me which antibiotic to use? We have to. Trust me, if we don't stand by that, if we don't stand by those value system using technology, today when the blood sample goes to when the tip of the catheter or whatever you send blood sample goes to the microbiology lab, everybody knows in the system which infection is going on and what antibiotic is received, which is the ideal. It's all available. Technology can pick it out. AI will tell you in 2 seconds that wrong antibiotics, correct it, this is the right dose, this is what you should be given. We need to somehow build in those values. If you follow good values, the outcome will be good in every possible manner. Your reputation, your money, you'll earn more money. We have seen, we have lived 50 years I am in healthcare. I have not seen a single doctor who was unfair and became very famous and had a good life. Doesn't exist. In the city I can quote hundreds such examples. And those who have lived with values are standing very, very tall and doing very well. Everybody respects them. So you may have a shortcuts. The purpose of this chamber, this attempt is not bringing technology here, telling you take a step back and see, philosophize it, think philosophically about it. Are we using good values with technology? That's the way we need to look at. Next slide. The compassion and integrity is most essential. There cannot be anything, there cannot be a technology. Today, fortunately, in our lifetime, we have seen from word processor to AI, how many people are so lucky? How many people have seen this the penetration of technology? Today, hospital is not just a clinician interaction. We have a receptionist, we have a IP specialist, we have an OP specialist, we have a analyst, we have a procurement guy. They were non-existent. With technology, we are getting all those people. We should bring more compassion. We should bring more integrity. We should be more ethical. If the technology does not help us in becoming compassionate, full of integrity and ethical, that technology is not worth adopting. Reject it. And there is no replacement to self-reliant India. Atmanirbhar Bharat is the only answer. We cannot depend on any Tom, Dick and Harry, anybody in the world. We have to develop technology. I was so happy to see the AI summit happening in Delhi. I couldn't go for various reasons. But the future is here. Let me tell you, take pride in India. India is growing. Every sector is growing. Technology is growing. We will be the leader. We are the leader. And that's possible with technology. When I hear about a scammer sitting in some village in Bihar and scamming some idiot in USA, I feel angry because he should have done it with us. If he steals our money, I'm happy, at least my money. But stealing money in USA, I don't like it. But the very fact he can use technology, he's using for wrong purpose. But the very fact he can do that, that means that availability is in your hand. Use it rightly. Use it ethically. Use it with compassion. And let's win the world. Be the leader in true sense. Thank you.
Thank you, sir. So every year when we plan what would be the focus areas of health tech, so we try and be as wider as possible every year with each edition. So this year we focused on technology and governance, and we are delighted that Dr. Roy has covered so much with with his experience and also brought in legacy aspect to it. So with this, we would request Mr. Abhijit Mojumdar, Chairperson of National Health Committee, the Bengal Chamber, and CEO of Apollo Multispecialty Hospitals Limited, to set the agenda for the day.
Distinguished dignitaries seated on the dais, distinguished dignitaries seated off the dais, and the delegates who are present here in this sunny morning at Kolkata, and wonderful and a welcome to you all. So as we gather today, and the efforts put by the team of Bengal Chambers, first of all, as the chairperson for the healthcare committee, we'd like to laud them for organizing such a conference with such an alacrity that we saw over a period of time. So the theme of the conference, of this health tech summit that we are organizing, and thanks to Shayantan for putting it together, is obviously the 9th edition of Healthcare Summit is to responsible healthcare, making it efficient with good governance. So we are stressing on multiple points. One is healthcare which is responsible, which is efficient, and with a good governance. So the focus is on those 3 points, and there's a vast, large points that will be deliberated over a period of time throughout the day today. Now, when we talk about healthcare and data that is driving today, and we keep hearing the words like artificial intelligence, machine learning, it is driven, as far as healthcare is concerned, on absolutely harping on 3 issues. One is the quality healthcare. Everywhere we talk about quality, and the by definition quality is quite vast, so I'm not getting into that. Second part is accessibility, and that's very vital for a country like India. And third point is affordability, and that's equally important for a country like us, which is vast. Overwhelming majority of population is harping on a quality healthcare as we develop to a stage of Viksit Bharat in 2047 that we are aiming at. Now, we also know health is a state subject, so a lot of discussions that will be hovering around throughout the day is specific significant steps taken by the various state government, and the state where we belong to has made significant strides on the age of healthcare as far as Bengal is concerned. So first, very briefly, I'll not take much time because the time would be of essence today, is basically the quality part of it. Huge revolution that is happening around the data, as the President designate has spoken about, initially touched upon, and Dr. Alok Roy, the past president for Bengal Chambers, has been spoken about, and Shayantan, who will be talking all through the day, and the other people present here. Now, there is a paradigm shift happening in terms of how data being used. So let me give an example. So the data that is being lauded today is a huge and zillion of data sitting together, can give you a predictability of how disease is changing pattern. It can give you a new insight into a drug discovery. There are hospitals, I don't want to name here because we are standing on agnostic platform, which has done revolutionary work with the Microsoft collaboration on the cardiovascular risk code. So that means if we are in this part of the country and not from US, very different would be set of predictive risk score as a person here that we are standing, and that will tell the probability of having a heart attack for next 5 to 7 years time, which is very different than somebody who's sitting at Connecticut. So that is something data which is locally being used today. We also give an example that AI enablement that is happening in smaller procedures, which is of greater significance today, like endoscopy or bronchoscopy. It is helping us to pick up a problem or an ailment at much faster rate, much earlier than any other thing. Like if you want to pick up a lesion, many of the people here are nurses and doctors, or a small kind of a wound that can develop to a cancerous growth, it can give a predictive score. So we are talking at a very, very local and a smaller level, which has wide-phrased ramifications when you talk about 140 crore people or 800 plus crore population in the world today. So that's one part of it, the quality, what has been driven by data. Obviously, we are also driven by what is called accessibility, and that's very important. And I want to talk about sometime where we stand, we get a lot of things around and we tend not to value it as much as it should be. Telemedicine is something that everybody talks about. A revolution has been started by government of West Bengal today, and if any one of you go to Shastho Ingit, and we keep talking to the Principal Secretary Health, and we know the amount of work that is happening, you can Google your thing, that Shastho Ingit by government of West Bengal, initiative taken. Any part of any health dispensary across the state is connected. easier said than done. The architecture and the technical enablement that has happened around is novel and something we should be very proud about, like e-Sanjeevani created by the central government itself. So in our clusters, the brilliance is happening around, which is elevating the standard of care. Good work is done by people all around. Good work has to be spoken. It has to be lauded. But the journey has begun, and the journey will continue because it's so evolving. Science is not going to end in a day. Lastly, we are also going to talk about the data privacy, the Data Privacy Act, DPDP Act, which is extremely important. I know my health data sits somewhere in the server, which is maybe in the cloud, and we were discussing in the morning. But how that is being used, that would have to happen with my cognizance and with my affiliation, and that is very, very important, and that's why governance comes into place. While we know the data is very important to predict a disease, for a drug discovery, for efficient and affordable care that is to be driven in the days to come, it is also important that we create an enabling structure at different level, at the corporate level that we are working on, also at the level of the state and the government level that we would be taking part of to give our data and being cognizant of what we are giving and what ramifications we have in the days to come. So throughout the day, there will be several deliberations that are being happening here. PwC has been kind enough and put all their thoughts together to release a knowledge paper about navigating privacy and protection in India's healthcare digital frontier in today's summit. The amount of work that has been done today, I'm sure is going to be a kind of a revelation for all, that what we should know about as an individual and what it can transcend into when the data is being put into practice. There are several healthcare professionals who will be joining, including nurses, paramedics, doctors who are part of this conference today. And there will be another conference which is given very important, that is happening on digital transformation for responsible care and making healthcare efficient with good governance and higher investment. So again, I was taking governance is a huge issue that we're going to talk about, creating an enabling structure, the financing, what Dr. Alok Rai was talking about, and it is very important. That's why there is no credible healthcare model which is all pervasive, all winning anywhere. Somewhere in South Korea, maybe a primary healthcare model, or a Cuba or a Brazil is successful. Nobody has been able to decode it perfectly. That's why it's an emerging science on which we have to work together. The idea of this conference is to stimulate thought, have some action paper and action points being driven, and that's what the healthcare committee is doing all through the day. It is only possible when everybody participates, and all of you are a torchbearer of this concept going forward as we step out of this room. And I'm sure we'll have a wonderful deliberation throughout the day, which will pave the way for a quality healthcare, which is affordable and accessible for you all. Thank you so much.
Thank you, Chairperson, for sharing the perspectives of both private sector and government sector in the endeavor of making healthcare for all. So I would now request Mr. Shantan Chatterjee, co-chairperson of Health National Committee, the Bengal Chamber, and partner PwC, to share the partner's address. We're wearing the PwC at this time. Maybe going forward, we'll like to have where our co-chairperson had, and here to Shantan.
Thank you, Angana. Good morning to all of you. It's always a privilege, and that's what I was saying, that this is the 9th year, and it's an honor and privilege as PwC to be representing and being a partner. Now, what a partner means for a chamber is that where we are A, aligned with the vision, B, are in line with what we want to be speaking, and C, very importantly, being code-driven. And that's exactly what has been there, and thanks to the chamber. I'm not saying this because it's just for the heck of it, but really feel it. So when we talk about a partner's address, in fact, I was just trying to think, because all my dignitaries on the stage, they've spoken a lot in terms of what's the agenda about, in fact, and Dr. Roy for the passionate speech. I really like that, the way you put that in terms of what we are, where we are. So what I would like to maybe spend some time, and I know time is essence today, is like, as a partner, what we have been doing and what we have tried to do this year. So when you think about healthcare, we have evolved, we are evolving, right? From the first event we had to where we are, India has evolved. I remember one of the first sessions we did was on technology, we did on blockchain, AI. So what we have been doing as a chamber and along as a partner is moving with time, being relevant with what we are doing. And very importantly, because at a chamber, what we are supposed to be doing, we are supposed to be basically getting forums like this to put some thoughts for discussion. put ideas where we can co-think, co-create, co-relate, I would say. And that's what we have been doing, and that's where we have moved, I would say. So the theme of this year is in terms of being responsible in healthcare. So I'll have my fellow co-partner talk a lot about that in the subsequent sessions. But very importantly, as we think about today, the stage at which we are, India is growing and buzzing. It's not a jingoistic, I would say, passion that I'm saying, because here is where the action is, and we are all part of it. And healthcare, infrastructure, education at the heart and soul of every individual's ambition as we grow. So quality healthcare, as we say, is all about providing that care, not in where we are sitting, not in a metro city and saying, okay, this is what we get, but for each of my 1.5 billion, the responsibility that we have to create that ecosystem where healthcare becomes not just a luxury, but necessity, and maybe in some cases a right to get that. And how do we do that? Not just saying in pockets of, I would say, centers, pockets of care, I would say delivery places, but something which is known as breaking some of the boundaries of access, breaking some of the boundaries of equity. No, it's not a socialist speech that I'm getting, but how do I ensure that healthcare is accessible, equitable, and fair for each of my citizens? And that's where the vision is. That's been the vision of, which is driven by both at the center and the state and all the things that we have been talking about. And in doing so, there are few questions which come in mind. Equity does not mean that I basically overlook things in terms of the quality. I overlook things in terms of being, I would say, what are the privacy aspect to it, and most importantly, guardrailing the trust which each and every individual puts on a caregiver when he or she has that, I would say, God forbid, you're not required to have that incident, but that's what it is. Now, what it means is when an individual puts that trust in a caregiver, how are we reposing that trust back? And trust is not in terms of just a very notional thing, but trust with his or her life, his or her, I would say in some cases, families, right? And very importantly, about the individual and about a life that I'm talking about. So it's much beyond if you were to think about it. And that is where some of the aspect that we'll be talking today is to say that as we grow, as we deliver this care, as we try to break the boundaries of equity and access, how are we being responsible in doing that? How do we ensure that when a person shares a data, and I'm using the word data now that is all over, how do we ensure that the person is safe to say, okay, fine, my data is not going to be used for anything else? How do I ensure that when I'm accessing a person's whatever records, the information that is passed, how is it we maintain that so-called privacy and secrecy? How do we ensure that the reason for what we are, when we are basically having that episode, is respected and not transcended? So these are all things which are not, it's not on the boundary of socialism as I'm saying, but the very heart of saying healthcare is about quality, healthcare is about equity, and very importantly about being responsible. And that is where the stage which we are. Because for any economy, any society to grow, healthcare for all is like a given. And for all means in terms of a responsible thing. And what is happening across, in fact, so Dr. Roy mentioned about the AI Summit. If you would have followed, healthcare was one of the prominent, I would say, showcase sectors there. So right from some of the innovations that were basically showcased there, and it was a very vibrant, I would say, atmosphere. Unfortunately, I could not be there, but I was keenly following it on social channels and on. So one of the key things was to say that how do we have some of the guardrails that are there? So there were standards, there were frameworks, both from again, in terms of now in AI, now there is any speech that you do where AI is not mentioned, is as saying, is this guy still talking in 2026 or talking about 2016? And that is the reality. So there were guardrails in terms of how data, how privacy would be basically be taken care of, and which is what our government and our regulators are doing. But what it also means for individuals is that the responsibility of ensuring those guardrails I mentioned is not only on the regulators. It's for each of us, right from a caregiver to an industry body, to a person who basically walks in, to know what are these, what do those means, and how is it being prevalent. Like the concept like data fiduciary, we'll talk about that, or in terms of the reason for accessing a data. So all those things have to be ingrained to a scenario where we say that that becomes a culture rather than a compliance. If you understand the two words, compliance or regulation always have a sort of a stick. Culture means something which is inherent in us. And that is what really we need to be driving, where anything in terms of respecting, being responsible becomes part of our culture. And I'm all talking about healthcare. There's nothing beyond that I'm talking about. Becomes part of our culture of how we look at it. Not just something which is, oh, there is a compliance, there is a rule, there's an act, that hence I need to be doing that. The day we start thinking and transcending is where the real movement happens. And trust me, it is happening, it will happen. I have full confidence. And obviously all the things that we have enabling is towards that. So that's what I would say. Again, not taking too much of thunder for some sessions to follow. But as we move ahead, again, I'm reiterating and placing thanks to the Chamber for having us as partners, and for all of you who are there in the room for trusting and being part of this co-shared vision. Thank you. Good morning again. Thank you.
Thank you, Shantan. We had actually, a brainstorming meeting with Shantan, and followed by a few more meetings with him and his colleagues, that what should be the theme this year. And we are happy that we have come up with an important theme. So now I would request Dr. Andrew Fleming, British Deputy High Commissioner, to please share his address on UK and the opportunities in health tech.
Just about. Namaskar. Good morning, fellow dignitaries on the dais, others off, and all delegates and friends. It's really a pleasure to have a chance to speak to you today about UK-India opportunities in health tech, a sector that I think perfectly captures the ambition of our partnership as we look ahead to delivery of UK-India Vision 2035. And for anyone who doesn't know, this is a document that was signed by our respective Prime Ministers in July last year, on the same day as they signed our free trade agreement. And I commend you all to read it online at your leisure, but in essence, it represents deeper economic integration, shared innovation, and growth that delivers real public benefit. Some of you know that I've been in India now for more than 8 years, and the first 5 of those years I was in Hyderabad. And when I arrived in Hyderabad, I knew nothing about health tech, healthcare, anything. But that city is one that really taught me a lot, and the gentleman next to me from Apollo Hospitals is definitely one of those places that I spent a lot of time. We did a lot of collaboration. Apollo were a big investor in the UK over time. Equally, they did a lot of work with companies from the UK that could add value to their work in Hyderabad, in Chennai, and of course in their other hospitals across India, including here in Kolkata. So I'm not an expert, but definitely it's one of the sectors I feel I know a little bit about. So it's a little bit sad that since I've been in Calcutta, if I'm honest, we haven't done too much on healthcare, but I'm definitely planning to change that. I'm definitely planning to bring some of my colleagues from the Department of Business and Trade to work here and do some roundtables and discussions, and we hope to engage some of you. And the reason for that is that if we look ahead to 2047 and the ambitions of the Viksit Bharat mission. This is a sector that must grow across East and Northeast India exponentially if that vision is going to be achieved. Healthcare as a sector is where strategy meets humanity. Across both our countries, healthcare systems face similar pressures: aging population, rising chronic disease, workforce constraints, and the need to deliver outcomes at sustainable cost. Technology is no longer an optional enhancement. It is absolutely central to how modern healthcare must and will function. And so, ladies and gentlemen, this is precisely where the UK and India come together so naturally. UK-India trade now approaches $56 billion annually, increasingly driven by knowledge sectors, life sciences, digital services, AI, and advanced healthcare innovation. And the free trade agreement between our respective nations will drive these figures even higher once it comes into force later this year. Under our shared vision, both governments have identified innovation-led growth, clean technology, and future services as pillars of cooperation. Health tech sits squarely at the intersection of all three. The UK's industrial strategy places strong emphasis on life sciences, AI, and data-driven public services. Through the National Health Service, the UK offers something globally unique: a trusted, regulated, clinical environment capable of validating innovation at national scale. Strength in regulation, clinical trials, and data governance means technologies developed or tested in the UK carry true international credibility. India, meanwhile, offers something equally powerful: scale, speed, and affordability. A rapidly expanding hospital sector, world-leading digital public infrastructure, and an energetic startup ecosystem make India an ideal environment to deploy innovation across large and diverse populations. Put simply, the UK helps prove what works. India helps scale what matters. This complementary matching is already very visible in practice. In digital health and precision medicine, the University of Leicester has partnered with Apollo Hospitals and Apollo University to establish a Centre for Digital Health and Precision Medicine. The collaboration focuses on AI-embedded disease prediction, cardiovascular care, and multi-morbidity challenges shared across both countries. Research validated through UK clinical expertise can then be refined and deployed at Indian population scale, accelerating innovation cycles dramatically. And a second area I want to highlight is commercialization. UK-India health tech accelerators and boot camps are connecting Indian innovators directly with the National Health Service, clinicians, and buyers. And this moves collaboration beyond dialogue into adoption, ensuring innovation reaches patients faster while opening pathways for co-development and co-export in global markets. And the third area, remote patient monitoring and step-down care, an area that will redefine healthcare delivery over the next decade. UK company Essensis, working with Manipal hospitals, demonstrates how wearable sensors, analytics, and real-time monitoring can support earlier clinical intervention, safer discharge, and continuity of care beyond hospital walls. This model is perfectly relevant as both countries shift towards community-based and home-centered healthcare. But to fully understand the opportunity, we must also look regionally. And here, Eastern India and West Bengal have an important role to play. Kolkata and the wider eastern and northeastern region are emerging as significant centers for digital capability, analytics, and healthcare delivery. Strong academic institutions, expanding private healthcare networks, and growing technology talent create the foundations for health tech innovation hubs. As connectivity improves across eastern India and into neighboring markets, the region is well placed to become a gateway for scalable healthcare solutions serving not only India but South and indeed Southeast Asia. For the UK, this aligns closely with our regional engagement, deepening partnerships beyond traditional metros and supporting innovation ecosystems that reflect India's full economic geography. Healthcare collaboration also supports wider objectives under Vision 2035. Skills exchange, clinician mobility, research partnerships, and trusted innovation standards. It strengthens supply chains, supports startups, and creates high-quality jobs in both our countries. So looking ahead, particularly alongside the evolving free trade agreement, healthcare stands out as one of the strongest opportunities for co-development, co-validation, and co-export. The real prize is not simply bilateral trade, it is joint leadership in creating healthcare solutions that are clinically trusted, affordable, and globally scalable. Because ultimately the UK-India partnership in healthcare is about more than technology. It is about designing healthcare systems that are more preventive, more personalized, and more accessible. Systems capable of meeting the needs of the 21st century. If Vision 2035 is about shaping the future, then healthcare is one of the clearest examples of how we can do exactly that. Innovate together, validate together, scale together, improving lives not only in the UK and India, but far, far beyond. Dhanyabad.
Thank you, Dr. Fleming. So we would now release the thought paper by PwC. It's Navigating Privacy and Protection in India's Healthcare Digital Frontier. So I would request the dignitaries on the dais to please formally release the thought paper. The thought paper, the digital version of the thought paper will be available in our website. Our colleagues at the Bengal Chamber will share the link with all the registered participants. You will get to know what is there in the thought paper. Mr. Vikramjit Singh, partner PwC, will make a presentation on the thought paper in just the next session. And with this, I would request our President Designate to please present token of our appreciation to Dr. Fleming. So thank you. We will move on to the next session and we will just take maybe a couple of minutes to do the changeover.